Hi friends, good evening. I'm Dr. Ashutosh Gupta and I'm a consultant fetal medicine. So today we're going to talk about whether this ultrasound can miss a Down syndrome baby और अदरवाइज अगर इस सवाल को इस तरह से पूछा जाए तो क्या अल्ट्रासाउंड डाउन सिंड्रोम बेबी को मिस कर सकता है या अल्ट्रासाउंड डाउन सिंड्रोम बेबीज को पकड़ सकता है, राइट? So there are some nuances to this question, right? So we had a one wonderful case in which we had some did some tests because of some high risk profile, and it turned out to be abnormal, right? But then the patient and the patient and the relatives, they were very apprehensive about the whole scenario, so they really waited it out, right? So we had that sort of a leisure of seeing the baby at multiple occasions and did the appropriate tests, invasive testing at the appropriate time, and then we identified and then we reached to some conclusion, right? So let us first go through these sort of in videos and slides, and then probably we'll talk about all this. So this is the fetus that we are seeing at 11 weeks and 6 days. So as you can appreciate कि nasal bone बहुत ठीक से दिखाई दे रही है, ठीक है? And this is the upper lower jaw and the nuchal translucency in the background, right? So you need to be slightly attentive. Then we have really seen the baby again at 14 weeks. So here it is. So even we can see this nasal bone. So that has been seen wonderfully well, right? And the nuchal translucency in the background. Then secondly, our focus gets into the heart. So heart may we are seeing this echogenic cardiac focus, and this might give a suspicion that we are seeing something sinister in the heart, right? Could be an AVSD or large muscular VSD in the background. And then this is at 16. So even though we identified कि वो ecogenic cardiac focus है, but we could separate it out, ये nasal bone है, right? And then we'll see the baby's heart once again. So we can see that it is separate from the IVS. इंटरवेंट्रिकुलर सेप्टम से दूर है और हमको कोई ऐसा AVSD या कोई सिनिस्टर कार्डियक एबनॉर्मलिटी नहीं मिली है, राइट? द क्वेश्चन इज दिस, व्हाट दिस सॉफ्ट मार्कर रिस्क मॉडिफायर्स होते हैं, दे आर नॉट डायग्नोसिस पर से, दे कैन बी आइडेंटिफाइड इन 40% ऑफ द केसेस, सो मीनिंग देयर बाय 60% दे कैन बी नॉर्मल. सो क्या अल्ट्रासाउंड डाउन सिंड्रोम में भी जो नॉर्मल हो सकता है? यस. फिनोटाइप बहुत बार इवॉल्व करता है और पोस्ट नेटली ही मिलता है, कार्डियक डिफेक्ट भी 40% केसेस में ही मिलती है. सो इसका मतलब 50% केसेस में नहीं होती है, और ग्रोथ ट्रेजेक्टरीज भी अब नॉर्मल पोस्ट निटल पीरियड में होती है. हाई रिस्क सिनेरियो में अल्ट्रासाउंड नॉर्मल और कोई जेनेटिक कंडीशंस abnormal हो सकती है, राइट? So the take home message is this, that the ultrasound can modify the risk, okay, can identify major structural abnormality, but it cannot rule out trisomy 21, right? So even though NIPT suggested high risk, confirmation is always by an amniocentesis. So like in this case that we have seen amply well, so we had followed this baby at 12 weeks, 14 weeks and 16 weeks before doing the amniocentesis, and we could identify no soft markers for trisomy 21 per se. कॉमन अंडरस्टैंडिंग में ऐसा ही होता है कि नेजल बोन ट्राइसोमी 21 का मार्कर है और न्यूक्लियर ट्रांसलूसेंसी कार्डियक मैलफॉर्मेशन का मार्कर है. डाउन सिंड्रोम कोलेजनोपैथी होती है और उसकी वजह से जो न्यूक्लियर ट्रांसलूसेंसी होती है वो भी कोलेजनोपैथीज की वजह से या कोई लिम्फेटिक्स की एबनॉर्मलिटी होने की वजह से या कोई कंजेनिटल कार्डियक एबनॉर्मलिटी होने की वजह से ही nuchal translucency ज़्यादा होती है, right? But in this case, neither the nuchal translucency nor was the nasal bone, neither the cardiac abnormalities was there. So even though we have identified that NIPT जो है वो ट्रोफोटोडर्म से आती है, and then it is not a true representative of the inner cell mass, but it was positive. So we did this amniocentesis at 16 weeks and 4 days, but in the meantime, we were had the leisure of seeing this baby 3 times. So the operator was the same, machine was the same, and the fetus was the same, but we could identify no soft markers. So the take-home message is this, and then we did the invasive, which is called as an amniocentesis, and we confirmed that it is a 100%. We did some 100 cells in the fish and all those stuff, and then it turned out to be that it is 100% Down syndrome, right? So take-home मैसेज यही है कि अल्ट्रासाउंड में तकरीबन 30% डाउन सिंड्रोम बेबीज दे कैन बी एब्सोल्युटली नॉर्मल, ठीक है? सो दीज आर सॉफ्ट मार्कर्स, they do appear, but they can be gestational age dependent. Secondly, there could be some issues with the growth lag to the long bones of the baby, but it is the delayed growth trajectory that might happen later in the gestational age when we are seeing. So 16 तो वो नहीं आए, और वो बाद में आ जाए, या कुछ ऐसे फिनोटाइप होती है जो कि पोस्ट नेटल पीरियड में पता चलती है, और एंटीनेटली इट इज वेरी डिफिकल्ट टू रियली कमेंट एंड टू पिक देम अप, राइट। सो टेक होम मैसेज ये है कि डाउन सिंड्रोम के लिए नॉन इन्वेजिव और इन्वेजिव जो भी टेस्ट हैं वो ही करना चाहिए, और अल्ट्रासाउंड उसको रूल आउट नहीं कर सकता। सो एवरी टाइम द पेशेंट वुड आस्क कि is there anything abnormal that we are picking up on ultrasound, and we were saying that the baby looks absolutely good on ultrasound. This has happened at 11 weeks and 6 days. This has happened at 14 weeks and 1 day. This has happened at 16 weeks and 4 days. But we were sticking to this very point that probably amniocentesis would give us the final answer, and we were not able to sort of so confirmation came on amniocentesis that it is sort of an aneuploidy, right? Thank you very much for your patience.